Do you have a cavity and you were told that you need a filling? Do you not like the dentist? Do you have anxiety and would prefer to have a filling fixed without shots, needles, or drilling? This is reality in 2026. You must catch cavities early enough, though, to reverse them without shots, drilling, and filling. With the AI technology that we have in our office in digital films, when we catch cavities early enough, we can reverse and stabilize them. Patients think they can do it at home, and there are a lot of things that you can do at home. I cover that in many of our videos. But many times, a toothpaste with minerals, a remineralizing toothpaste, as my patients say, oh, I'm using that and I'm not eating sugar, that is not enough. The cavities are in between the teeth where they touch, and your remineralizing toothpaste cannot get to them. The remineralizing toothpaste many times can't be absorbed by your tooth. You're not killing the streptococcus infection, so it can still spread. What we can do in the office is use things like ozone, oxygen therapy, to kill the bacteria naturally without chemicals. We can use things like silver, which also kills streptococcus bacteria, fungus, without chemicals. We can use products with minerals. Hydroxy, that's what's in a lot of toothpaste, but we have it at 4, 5, 6, 7 times the strength. And in a matrix, usually a natural tree resin, like people make chewing gum out of, to hold it into the area. And one of the most important things that I can do is to actually, again, separate those teeth slightly so we have access to the cavities that are in between the teeth, or sometimes they're deep down in the grooves like this, or again, people are brushing and they're brushing up here. Your toothbrush bristle is not narrow enough to get down here, and that's where the bacteria is spreading and spreading deeper into the tooth. With ozone gas molecules are extremely small. In ozone therapy, we can get deep into those grooves, and when we separate the teeth, we can get where the teeth touch, and we can kill the bacteria naturally with oxygen. Ozone is strictly O3. It's an extra molecule of oxygen. When you put it in the gas form, it's so small that it can get into all of those areas that something physical like your toothbrush bristle just will never get to where the cavity is spreading. And down here is where the nerve is in the tooth, and that's where we want to avoid getting bacteria, infection, and inflammation in, because it is a vital organ, the tooth. There's blood flow, there's arteries, veins, lymph, and nerves. So many people want to wait. They're like, I don't want to drill on my teeth. Okay, and then if it's too late, they will get to the nerve in the tooth. And people don't want a root canal either. But who also wants to have their tooth pulled? Then your entire bite is not stable. So if we can get to them early enough, we can employ these methods to get access to the deep areas of the grooves of the tooth, use some of the things that patients already can use at home, just in stronger doses like hydroxyapatite and minerals. But we also have targeted peptide therapy and oxygenated ozone to get to these areas to kill the bacteria and re-strengthen the tooth. I haven't talked much about peptide therapy yet, or silver, so let me go over some of those different things. And I wrote some notes on how things work so people understand that ozone gas is non-invasive, it's painless, it kills decay-causing bacteria, it will stop the early stage cavities from progressing. That's what we're doing, we're stabilizing. And the ozone actually does promote tooth remineralization when you give it the minerals that it needs. Not only just in toothpaste, we need to be having them in our diet. When we apply ozone to the cavity, the ozone actually gets rid of toxins, reduces the inflammation, and it stimulates healing because we get more blood flow. When we get more blood flow, because we use it for the gums too, all kinds of ozone and lasers. When we get more blood flow to an area, we get a healing naturally. What we do is we'll place a small cup over the affected tooth so that the gas stays right on it. It only takes about 60 seconds, but we need to let all the molecules of ozone and colloidal silver get to the tooth without your saliva and your tongue moving it. So we have these specialized cups, and we can get the ozone, we can get the peptides, and we can get the colloidal silver, glucose iodine, all these things directly to where the decay is. After the therapy, the decay process is stopped and the lesion is disinfected. Then we need to pair it with things like remineralizing. Some people, are comfortable with things like fluoride. That has been used, sodium fluoride in the past, not the chemical component. That's a pesticide, aluminum fluoride. Some people are comfortable with that, and it does have, a history of working. There are other alternatives, though, if fluoride doesn't work for you, because for certain people, fluoride is an ion that causes them a lot of problems, thyroid issues. There's just a lot of reasons for fluoride not being the number one ideal remineralization product in this day and age, even though it has worked in the past, because it has some cons. So the peptide product and the remineralization products that I use, they have, I don't know how much you guys know about peptides, but I'm kind of crazy. I have whole videos on peptides. Peptides for the entire body, for your brain, for your gut, for your bones, for your arthritis. Peptides for teeth, though. P11-4 is the exact peptide that we use. It treats early non-cavitated caries. It promotes guided enamel regeneration. That's why I have to see you early enough. It does not provide guided dentin regeneration. That's when people were remineralization. That cannot occur once things are in the dentin and the pulp. As long as we can see you early on and show you these spots, and we know where they are, we can work directly, precision on exactly where the demineralization is occurring. And the P11-4 peptide, what it does is it puts it penetrates the enamel, and then it puts down a 3D scaffolding, and that attracts everything in your saliva. That's why lips sealed, nose breathing. When we get this scaffolding into the tooth that the peptides are creating, so kind of like this, then in the saliva, as long as you are eating things that have phosphate, have calcium, have magnesium, have all the boron, all the trace minerals that we need, it actually attracts them like magnets into the peptide matrix structure. And it builds something that everyone's wanting to apply to their teeth now that didn't want fluoride, hydroxyapatite. I'm going to remineralize. I got remineralizing toothpaste. Well, what's in it? Hydroxyapatite. That's great, except that being applied here and not having a matrix to actually form, not being applied on the cavity itself, because there's just no way to do that with a toothpaste. The toothbrush bristle cannot get in between the teeth, and it cannot get it in this deep groove. So by getting the teeth separated or getting gas in the groove to open up the pores basically and get these peptides in to make the scaffolding, now when you use a remineralizing product, whether we use hydroxyapatite varnish in our practice, or we use other minerals, because that we have a ton, you have a ton that you can use at home, then those minerals, even from your own saliva, that's the thing, your body knows what to do. If you're feeding your body minerals and they're in your saliva and your nose breathing and not mouth breathing, that saliva will get into this scaffolding. And like I said, the phosphorus, the magnesium, the calcium, it's there. When they all come together, they will form hydroxyapatite, and that stabilizes and strengthens the tooth, reverses the cavity. Let's see if I have any other notes there. I don't want to get too nerdy on all the technology. Like I said, a lot of it's just biomatrix and oral microbiome. That's something I didn't touch on, but that we will work with you in the office for after we are either reversing cavities, stabilizing gum disease, or helping you avoid a root canal. The oral microbiome, making sure that you actually either supporting it with dental probiotics or foods that are probiotics that your oral biome needs, will work on that as well. So that's a really important thing. See if I missed anything else on that. So the success rate, people want to know, well, how successful is this? Because sometimes it's not something that insurance covers, and they don't know if they should try it, or they've gotten frustrated because they've been remineralizing their teeth at home, and now they come in and they have one tooth's turned into a root canal because they haven't wanted us to drill and fill, and they've just been doing stuff on their own for years, and they've had these bigger problems, so they're scared to take on something sometimes a little less invasive when we can. But so the success rate is really at about 93 to 95% right now, which is fantastic. when we get to them early enough. So the oligopeptide that we can use and the ozone gas, like 95% success rate. I'll share some photos in a different video. I'll just do a kind of a nerd out, boring, like digital display of what the lesions looked like on an x-ray years ago and what, as we have treated them, have looked like. So the success rate can be a 93 to 95%. It can take multiple exposures sometimes. So I know when we were back just using things like glucose iodide and silver diamine fluoride, you definitely had to do it a few times. Using ozone and the peptides, it does seem that sometimes now 1 or 2 treatments is adequate, which is fantastic. Because again, even though it's not drilling and filling, who wants to see us more than you have to? Even though our patients do tell us they love us. So the oligopeptide, 103 or 104, the ones that we'll use, that will create the protective layer. It's also an acid protective layer too. So that's something else that, like when you're using just hydroxy apatite toothpaste at home, you're not doing anything to protect against the acid. And in this day and age, people are eating processed foods that are turning into acid. I have teenagers. Of course, you'd think my kids wouldn't drink things like soda, but they're not always with me, and they're going to events after sporting games and going to dinners with other teens, and I know what they're drinking and eating. The carbs that are on the outside of the chicken combined with what they're drinking. Right, we actually need an acid protective layer, and that the minerals aren't going to just be enough when you're already hitting them with those kind of acids. So that is what applying these products in the office do, is that things like ozone and things like peptides actually can put a matrix on the outside of the tooth to protect it. So as much as I would like if my kids could not eat any of those harmful processed foods, the fact that I can basically put a little rain jacket on all the weak areas that are demineralized in their mouth, that protects not against water and rain, but protects against the acid and the sugar, yet allows the minerals in the saliva and the good things that they do eat in their diet, because they do have some good things too. Luckily, they love some really nutritious foods as well. And warm saltwater rinses, like that's something that even my younger kids, like I can actually get them to do. Whereas, flossing, let's admit it, a lot of people do not do that as many times a day as they should. Yes, at least 2. But warm saltwater rinses, as soon as I fill mason jars with pink Himalayan salt or Celtic salt, black volcanic salts, make it fun, make it different colors, they'll at least swish. And again, those 84 minerals are there, and they can go into this biomatrix that we have placed on the teeth with peptides and rebuild the tooth structure against everyday insults. If you can't be perfect with diet and drinks and stress and clenching and grinding and nose breathing, because that can take years to reverse all of those different factors that are contributing to your cavities. Let's see if I missed anything. I think I covered ozone and peptides pretty good, and I think I covered a lot of the remineralization. Like I said, with trace minerals, hydroxyapatite, and weeds and dandelions and bitters. Those are some of my favorite ways to remineralize. Arugula, personally. Yes, so when we do all this, the tooth can harden, it can heal, it can reduce the needs for filling. It is 93 to 95% effective, can take 1 to 3 treatments on the same area of the tooth, depending on if you're going to employ everything. And then, like I said, laser energy, inflammation, and then getting on some dental probiotics or gut probiotics, or just getting those naturally. That will all stop the process. I'm excited to help you not need fillings. And I'm excited that my future as a dentist will not include doing as many fillings. Like I said, I'm really passionate about injection molding and cosmetic techniques that are non-invasive. And I love healing the body and decreasing stress and clenching and poor archways. So the less fillings I have to do on people's teeth, the more time I have, and the more that patients have the ability then to really do dental work that's life-changing, that actually gets rid of jaw pain, that widens their arches, gets them more oxygen at night, decreases their stress, gives them a beautiful, lasting smile. And they're not signing up for just fillings that turn into root canals that turn into crowns and extractions and implants. We don't have to go down that route. We can really restore where maybe we've lost a tooth or two, and just make the bite most ideal, and work on all the relaxation and muscle myofunctional therapy exercises that protect the teeth from these small cracks. And that started all of this process of cavities in the first place. So I'm excited that this is our future, and I'm glad that you found us so that you know that our future in dentistry can be your future in dentistry through non-invasive techniques.